So we all know about traditional diabetes self-management. Lance your finger, take a drop of blood, put it on a specialized strip, put the strip in a meter, wait a few seconds, get a reading. Hopefully the reading causes you to take some action, and hopefully that action, typically administering insulin, is the right decision making. The challenge is that once insulin is on board, it has no brakes and is very difficult to steer. So what is continuous glucose monitoring? Well, let's use the 4 finger stick drops of blood and to create a pattern over a 24-hour period, each independent measurement, but you connect the dots and at least you begin to see a pattern. But with continuous glucose monitoring, you see a much different pattern. You add 288 measurements, we measure every 5 minutes, and then port that information wirelessly to a receiver. So the picture that you see is far different. I always liken looking at fingerstick measurements to trying to determine the plot of a movie off of 4 frames versus having the entire picture to look at. So the Dexcon system is quite simple. It consists of a sensor, a transmitter, and a receiver. From the standpoint of the sensor, it is inserted by the patient into the subcutaneous tissue with a simple deployment system. The transmitter is snapped into the base and begins to transmit immediately that information to the wireless receiver. The receiver has programs, so not only do you get the graphical representation, you can look at the immediacy of what your glucose level is, but you can also scroll back all the way to 24 hours to see where you've been. Because if you don't know where you've been, it's hard to know where you're going. There are programmable alerts that are settable, some at maximum threshold. If you want to know when you're crossing through 80, or you want to know when you're crossing through 200, those are settable, and alerts, both auditory and vibration, alert you to when you've reached that level. There's also settable alerts for change of glucose levels. So we can change it at either 2 mgs or 3 mgs per minute, so that as you're either rapidly falling or rising, you also have alert systems that tell you to take action before you actually get to the point of threshold. So what CGM does is CGM gives you speed and direction, and that is an extremely important attribute for patients with diabetes. And let's use this example, 120 from a meter. What does that patient do? Do they add insulin? Do they add food? Or do they do nothing? It's just a number. It has no other information. But you add to that the continuous measurement. Let's use 112 as an example, and 2 down arrows. 2 down arrows represents that you're falling at a rate greater than 3 mgs per minute. You also have trend arrows over the last 3 hours, or trend graphing that says that if you look at that over the last 20 minutes or so, you are falling. So the last thing this patient wants to do is take insulin to drive them lower. They do need to take carbohydrates. And at this rate, if they're 112 and falling at greater than 3 mgs, at 70 mgs is the definition of hypoglycemia, which is also associated with cognitive impairment. So this particular patient has a great risk factor that within the next 15 minutes, they may in fact have cognitive impairment and not be able to actually treat themselves. So we know healthcare is a critical global issue. If I just look at aging as an example, we know that every day in the United States, 10,000 individuals reach the age of 65. Well, diabetes is a global epidemic. Today, more than 350 million people are afflicted with the disease. But I want to point to the right side of the screen, and this is what happens every day in the United States. These are daily statistics, and diabetes is a very costly disease. Just recently, in the last month, we've had new statistics from the American Diabetes Association that on an annual basis in the United States, we spend $245 billion. You contrast that to just 5 years ago when that number was $170 billion. If we dial it down into the hospital sector and look at one condition, hypoglycemia, and the cost. So this is an average payer with 5 million members. That the cost of hypoglycemia event is about $17,000 per event. So to that payer, based on standard statistics, their payment would be around $118 million for the cost of care for hypoglycemia admissions in a single year. And yet we know that CGM can avoid many of the hospitalizations associated with hypoglycemia by preventing hypoglycemia entirely. Lots of studies, peer-reviewed, randomized, independent, prospective, all demonstrating the benefits of CGM of both type 1 and type 2, particularly those type 2 patients that use insulin. Most recently, study now looking at behavior modification. So these patients in a type 2 non-prandial use of insulin were looked at initially with 12 weeks of therapy with CGM, and then that therapy was terminated. But you see at sustainability of effect at 52 weeks, lessons learned, behavior modification tools that they were able to incorporate into their way of life. Even in the critical care unit, CGM is now becoming more important. And these are some of the areas in which we show excellent detection, infection, wound healing, things that glucose has a dramatic impact on. So you know all of this. I mean, we're now dated in terms of there are more mobile subscribers back in 2002 than landlines. More global smartphones and tablets exceeded PCs in the last 3 years. Everything is going to the cloud. And next year, smartphones will actually surpass a PC as a cloud-connected device. Everything we do will be in the cloud. Consumer health will be in the cloud. Healthcare information. Medical imaging systems today. Patient caregiver interaction will all be cloud-based. This will be your new reality. And there are lots of reasons for cloud-based health. So if we look at it even from a clinical, non-clinical, or consumer base, it's a more effective, efficient way in which to deal with medicine. It is estimated that electronic data billing today would save the United States $32 billion a year in healthcare savings. When we look at chronic care, well, it was mentioned earlier today, empowering patients has got to be something that we do as the population ages and the increase in chronic medical disease. So redefining personal health, today we do it in the cloud. So what we do with the TUNet Hub is we're in a number of pharmaceutical trials in which we blind our receiver data to the pharmaceutical companies. They connect it via the TUNet Hub, which is a gateway system, a home gateway, and do data analytics and produce reports for the investigators and for the physicians. And in the future, in the very near future, in fact, all of that will be done through a smartphone. So this is a Sony Ericsson phone, off the shelf. We have an app to it. And right now I'm actually transmitting data, glucose data from me to this phone. So this is something that is real and will be very near in the future. The challenge for us is many of you heard about Class 2 medical devices. Well, continuous glucose measurement is a Class 3 medical device to the FDA and subject to all the challenges associated with that regulatory process. So the new model is you will manage all of your health care in the cloud.